All right, let's dive in. Today, we're talking about a condition that's actually one of the most common inherited neurological disorders out there. But you'd be surprised how many people have never even heard of it. It's called Charcot-Marie-Tooth disease, or CMT for short.
Now, that might come as a bit of a shock, but get this. CMT affects roughly 1 in every 2,500 people. To put that in perspective, it's more common than a lot of conditions you probably have heard of. And this isn't just in one part of the world. It's a global issue, touching lives on every single continent.
So that's the big question, isn't it? If it's so common, why does it seem to fly under the radar? Well, that's what we're going to unpack over the next few minutes. We'll break down what CMT is, how doctors figure it out, and most importantly, how people manage it day to day.
Okay, so to really understand why CMT can be tricky, we have to start with the basics. What is it? At its heart, Charcot-Marie-Tooth disease is a disorder of your peripheral nerves. You know, the huge network of nerves that live outside of your brain and spinal cord.
There are basically two ways CMT comes about. The most common way is that it's inherited, passed down from a parent. But, and this is a really key point, it can also pop up out of the blue from a spontaneous new gene mutation. That means someone can have it with absolutely no family history, which is one reason it can be so hard to pin down at first.
One of the really interesting physical clues comes from what CMT does to the nerves themselves. Think of the myelin sheath as the plastic insulation around an electrical wire. And some types of CMT, that insulation gets way too thick, which makes the whole nerve get bigger. And get this, sometimes these hypertrophic nerves can actually be seen or even felt right under the skin, especially around places like the elbow.
So you've got this damage happening at the nerve level, but what does that actually look like in a person? How does it translate into physical signs and symptoms? Let's take a look at what a doctor is searching for when they suspect CMT.
A doctor isn't just looking for one single thing. They're piecing together a puzzle. They're looking for a specific pattern. You'll see things like muscle weakness and even a reduction in muscle size, especially in the extremities, so hands, feet, arms, and legs. They'll also do that classic knee-jerk test because slowed tendon reflexes are another big clue. Add in sensory loss, and when all these signs start showing up together, the clinical picture really starts to point toward CMT.
All right, so once those initial signs raise a few red flags, what happens next? How do doctors move from just a suspicion to a rock-solid confirmed diagnosis? Well, there's a very clear process they follow.
The journey to a diagnosis pretty much follows these 3 steps. It all kicks off with a really deep dive into a person's medical history and, crucially, their family history. Step 2 is getting a referral to a specialist, a neurologist, for a much more detailed exam. And then, the final step is a series of diagnostic tests to get that definitive answer. So, let's break down those key tests. First up, you have nerve conduction studies, which basically measure how fast and how strong the signals are traveling down your nerves. Then there's an EMG, which checks how well your muscles are actually responding to those nerve signals. Of course, there's genetic testing, which can pinpoint the exact gene causing the trouble. And in some situations, a doctor might do a nerve biopsy, where they take a tiny sample of nerve tissue to examine it up close.
Getting a diagnosis is a huge moment, but it's really just the beginning of the journey. The next, and honestly the most crucial part, is all about managing life with CMT. So let's talk about the proactive strategies that make all the difference.
This right here is the absolute key takeaway for management. While there isn't a cure for CMT right now, treatment is anything but passive. It's all about being proactive, using smart strategies to manage symptoms, hold on to mobility, and preserve muscle strength for as long as possible.
A lot of the time, managing CMT comes down to really practical, targeted support. For example, as you can see here, if someone has weak ankles, something as simple as wearing high-top shoes or boots can provide incredible stability. For hand weakness that affects fine motor skills, a thumb splint can be a total game changer. These are simple interventions that can make a huge difference in daily life.
And here's why this matters so much. Timing is absolutely critical. Starting physical therapies and using these kinds of assistive devices as early as possible is vital for long-term success. This proactive approach helps prevent other problems, like muscle strain, and it can even help reduce how much muscle weakening happens over time.
And this brings us to a final, and I think very hopeful thought. Since we know CMT is a genetic disorder at its root, the future of treatment likely lies in genetic medicine. As amazing technologies like gene therapy continue to advance, what kind of new possibilities might open up for treating, or who knows, maybe even curing this condition? It's exciting to think about. Thanks so much for joining me for this explainer.